Well, hello, I'm Doug Apple, back with another special interview for you today. I've got a couple of news items, and then we're going to get our resident expert to comment on them, and it involves the price of healthcare, your healthcare costs, your health insurance costs, how much is coming out of your pocket. These are things that are a burden on the American family, and that's one of these headlines. So I'm on the phone line with Mike Sharman. He's the legal counsel for Share Healthcare. We've been talking about them here on Wave 94. You've heard their ads. They bought a little airtime. But we're going to go into a couple of news items and open your mind, open your eyes to what's going on here. And then also, we'll talk some about Share Healthcare and how they might just be the solution for these rising healthcare costs for you and your family. But here are the headlines. This first comes from ABC News. It says, Biden and Bernie Sanders join forces to promote lower healthcare costs. Well, we all want lower healthcare costs, but at what price, right? Well, anyway, here's a line in the article that says this. His aides and Democratic officials say Biden's achievements, such as lowering healthcare costs, are popular with the public, yet the incumbent president hasn't yet gotten the credit from the voters. So it says he has lowered healthcare costs, but he's not getting the credit for it. Meanwhile, Scripps News has this headline. Study shows half of U.S. adults say healthcare is difficult to afford. It says this, quote, healthcare costs are on the rise, and a recent poll shows the high cost of healthcare is a burden on American families. And according to the poll, quote, many families say lowering their out-of-pocket healthcare costs is their top healthcare priority. Well, if you're listening today and you would say, yes, lowering my costs for healthcare is a top healthcare priority for me and my family, then listen up. Mike Sharman is going to share with us, and we'll also tell you about Share Healthcare. But Mike Sharman, what do you think of all this?
Well, he's definitely not getting credit with the voters when his disapproval rate is vastly higher than his approval rate in polling. And people living out their lives just know they aren't better off than they were 3 years before this. And we can look at the neutral entities that are doing inflation calculation, and the healthcare inflation rate, which, again, it sort of depends on how are they defining healthcare. But that's gone up 10%. There's no year that Biden has been in office that has gone down since President Trump left office. It never has gone down. So the lead sentence in that article that you mentioned, Doug, is President Joe Biden teamed up with Senator Bernie Sanders on Wednesday to promote his administration's efforts to lower the cost of inhalers and other healthcare needs. So inhalers are important to the people who have inhalers. But what we're seeing is maybe they've reduced the cost of an inhaler, but overall healthcare costs have gone up. Ask anybody who's gone to a doctor or the hospital recently, gotten an x-ray, gotten an MRI, is this cheaper than it was 3-4 years ago? And the answer is absolutely not. Ask the person in a doctor's office or a hospital's finance office, have your prices gone up or down in the last 3 years? You aren't going to find a single one of them that says they've gone down.
No.
So let's look at those first words in that first sentence of that article. President Joe Biden teamed up with Senator Bernie Sanders. All right. What political ideology does Bernie Sanders have? Communism. That's what he has always been affiliated with. That's what he's promoted. Those are the countries that he promotes. So President Joe Biden teamed up with Senator Bernie Sanders, who the nicest you could phrase him is a very strict socialist. But communism's what he goes for. I mean, Moscow, Cuba, etc. Anything that Bernie Sanders promotes is promoting the communist agenda, literally the Communist Manifesto. The only thing that Bernie Sanders winds up being relatively conservative on is the gun control issue, and that's because Vermont voters absolutely will not tolerate gun control. So what do we do with this headline and the article that says that, and that sentence you read, his aides and Democratic officials say Biden's achievements such as lowering health care costs, well, he never did. He just flat out never did. Health insurance is not less. Health care is not less. Hospital costs are not less. And neither are doctor visits. They just aren't. So what do you do with that fact? That here's what the article says, contrast that with what is actually occurring on the ground. What do you do with that? Well, you can't believe what they're saying. And unfortunately, I don't like to promote skepticism or just that clear, direct criticism of a public official that I'm doing now. But there's no other choice that we have. You look at the fact, you look at what they're saying, and what they're saying is a lie. And when we see a lie, we know that it's coming from the father of all lies, which means it's not something that God approves of. So we have to turn away from that. We can look at this, and this, his aides and Democratic officials say Biden's achievements such as lowering healthcare costs. Okay, so we just recently had the great big blow up about the Transgender Visibility Day proclamation being announced for Easter Day. Well, who apparently did that? President Biden's aides and Democratic officials. How do we know that? Because when President Biden was challenged with, well, why on earth did you do this on Easter? Why did you promote this Transgender Visibility Day on Easter? He directly told the reporter, I never did that. The person who's telling that is misinformed. Well, the proclamation was dated just days before Easter. Just days before. And it was signed apparently by Joe Biden. But Joe Biden just days later either couldn't remember that he signed that fairly significant proclamation, or he never signed it. Either way, we're being presented with a lie. Either the signature itself is a lie, that his aides had signed it, and he did not, which is a lie. You signing somebody else's signature without their approval, and if we believe him that he never did that, he did not say, oh yeah, use the auto pen, go ahead, it's all right with me. I approve this proclamation, go ahead and sign it. All right, if that's the case, and somebody else can do their signature, and it's truthful. But he's saying he never did it. The person's misinformed about the proclamation actually occurring. So if Biden did approve it, he's lying there. If he's telling the truth, his aides are lying, and the whole thing is a lie. And so much of his presidency is a lie, because how do we know who's doing what? And again, I don't like being a radical conspirator, conspiralist, etc. But we just have to look at the facts at this stage in our nation's history. And we need to start looking behind the curtain and seeing what is occurring, looking at the reality on the ground. Are you better off? Is your health care less expensive than it was before? What can you do about it?
Anybody can blow smoke. That ABC News article talking about he lowered healthcare costs, but he didn't get the credit for it. But you made such a great point. Well, when you went to the doctor, was it lower? When you had to go visit the hospital, was it lower? When you had a procedure of some kind, was it lower? What's happening on the ground in real life versus whatever the public relations spin is, you could just look around. We saw that a lot during the pandemic, is you look around and you look at everybody and you look at what's happening in your town, and then you look at, the whatever spins are being put on the subject. And that's where the two articles come in, because we have the one from ABC News saying that he's lowered healthcare costs and hasn't gotten the credit for it. And then we have the Scripps News polling where people or families are saying, like, there's a little bit of panic. They're saying this is a hard burden to bear. And then you left us with that little cliffhanger. What might we do about it? So, Mike Sharman of Share Healthcare, what might we do about it?
Well, plug in the share healthcare part. It's a pretty simple solution. Share Healthcare is a Christian ministry. It's a 501c3 nonprofit, and it's $149 per month for a single, $249 for a couple, $349 for a family of four, and then $50 for each child afterwards, to be able to share one another's medically necessary medical expenses. So that's a pretty straight up way that one can deal with the increased cost, because we haven't increased our prices at $149 for a single, $249 for a couple, $349 for a family of four. We haven't increased them during President Trump's term, and we haven't increased them during President Biden's term. So we've been able to manage that. And when I say we have, it's not really so much the employees or the vendors of Share Healthcare that have been able to do it. Our members have. You know, their lifestyle, the way they live, the way they relate to their doctors and hospitals, the fact that they don't go to the doctor at every little single thing. They do when it's medically necessary, and then that bill is negotiated and shared, and it just winds up being less expensive. One reason is it isn't subject to government control. It's not part of Obamacare. It's a healthcare share ministry, which is exempt from Obamacare. The vast bulk of the states, the supermajority of the states, has specific legislation that says healthcare sharing ministries are not insurance, and so they aren't regulated. So those are some reason why it's less expensive. So, you know, yay us, and everybody go take a look at sharehealthcare.com. Give us a call, 1-844-SHARE-HC, and look and see if this works for you. But there's other things that consumers can do too. Look behind the curtain on everything. You know, when you're looking for a car, don't just look at the paint job. Don't just take what they're saying is our suggested retail price. Really go behind it. Look at the ways of getting the best deals. Talk to individuals who are selling perhaps different than car dealers. Actually plant a little bit of a garden so that you have a little bit of food coming in. You know, do lots of different things to be more self-sufficient, more aware of what prices are and what you can do. I like going out to eat a lot, not so much because of the restaurants, because my wife actually cooks better in a restaurant, but I like going out because we typically go out with other people, and so do others, but that's expensive. So have more people coming into your home to share. My point in each one of these different little examples is think about what you're doing with your expenses. Think about that and look at how you can make it less expensive. And getting out of debt, do that famous snowball effect. Pay off the smallest bill that has the highest interest and then put that same money into the next one and so on until you're out of debt. It really works. We've done it. So have millions of others. It worked. But then in terms of how did we get here? Well, we got here because we've been putting into office the wrong people. Not just at the presidency, but state level, local level. Look behind the curtain there too. Check that person's back trail. What do they actually do as opposed to what do they say? That just makes a huge difference. You know, personality-wise, Biden tends to say things nicer than President Trump. Those are our two presidential choices this year, really. But what do they do? What's the practical effect? You will know them by the people that they are around. You'll know them by the company they keep. Birds of a feather flock together, so to speak. Well, we got Joe Biden and Bernie Sanders. We have, you know, President Trump and the very good people that he has around him, as we can see by the policies. Now, I don't want to be too promoting one person or the other. You know, we're a 501c3 ministry. You know, we're on a Christian station. But it's part of look behind the curtain on every one of the candidates that you're looking at this fall. And whether your state has an election every November, some state has an election every November. And then because we have primaries, we have them typically in the spring or in the summer. So there's multiple times for us to be doing what Thomas Jefferson had proposed, essentially, of having the constant revolution. And then President Lincoln, when he was being challenged about whether he was making the right decision or not, he said, well, if I'm not, the people will be able to put me out of office and I can only do so much damage in 4 years. They'll put somebody else in, and it'll change things around. That premise is true, that we can be constantly changing what's going on in our culture if we look behind the curtain, actually look at what's been the back trail of the people who were electing or being asked to vote for. Fortunately, here in Virginia, in my congressional district, we have just many different really good candidates running this fall. So we run in the primary, et cetera. So we have lots of good choices. That's not always the case. Sometimes you're going to have to go to your neighbor and say, you may not have thought of running for town council, but I can see what you do in organization. I can see what you do in your business. I can see what you've done in your church. You volunteer when other people don't want to. If you want to run for town council, I'll help you out. That might be what is needed. Or if somebody comes to you and says, have you thought of running for the school board? Maybe instead of brushing it off right then, you might say, I hadn't thought of it, but you bringing it up makes me think maybe I need to pray about that. The issues that confront us are vastly more important than are we having increasing healthcare costs or not. The issues that are confronting us are, will we have a recognizable United States of America in the next 6 years, 10 years, or will we not? And those decisions are ours to make. We're absolutely having outside pressure being put on us to try to make sure that never occurs, that we do not have a recognizable United States of America. But we can change it. This has been from the beginning and still is a nation of we the people, by the people, for the people.
Well, I agree with that, and we can be involved, and we should be involved. We don't have a government that is lording it over us without a means of taking care of it. And we do that at the ballot box and also by being involved. But like you said, one of the things we do want to say is you have the opportunity to save money on your healthcare costs through the Christian healthcare sharing ministry, which is Share Healthcare. We've been talking with Mike Sharman of Share Healthcare. Thanks for your time, Mike. If you want more information, you can go to the website, sharehealthcare.com, or give them a call at 1-844-SHARE-HC. If, like the poll says, you're one of those families feeling the burden, Share Healthcare is designed specifically for Christians to share the burden. And for Wave 94, I'm Doug Apple.